welcome to the very first ever podcast, a conversation with expert series. So my name is TK and I'm the Regional Projects Officer from the International Pharmaceutical Students Federation Asia Pacific Regional Office.
My name is Chrissy Saul, one of the other moderators and Public Health Coordinator in IPSF APRO.
So IPSF is the leading international advocacy organization for pharmacy students with the aim to promote improved public health through the provision of information, education, and professional initiatives. And we are from the Asia Pacific arm of IPSF.
For this series called Chat with an Expert, we engage in a conversation with an expert who has specialized knowledge about a specific disease or specific area of practice, or about a specific public health issue.
Yep. Today we are honored and thrilled to have Associate Professor Joyce Lee from the University of California, Irvine, here to talk about diabetes. So she's currently the Health Sciences Clinical Professor from the College of Health Sciences in UCI. So besides from being a professor in UCI, she's also a registered pharmacist in Singapore and California. And she's board certified as a pharmacist in ambulatory care and pharmacotherapy specialist. And she's also the American Pharmacists Association certified immunizing pharmacist and immunizing faculty member. So Dr. Lee, Prof. Lee, completed her Doctor of Pharmacy at University of California, San Francisco. And later on, she went on to win her project on pharmacy practice residency in ambulatory care, won the Resident Project of the Year award, and she herself won the Resident of the Year award.
Also as an accent teacher, she has won many teaching awards in faculty, university level, and recognized by Singapore National Healthcare Group as an Outstanding Education Partners Award. She is also the recipient of ACCP New Clinical Practitioner Award 2013 and UCSF's 150th Alumni Excellence Award 2015. Her experience in pharmacy-managed ambulatory care clinics has allowed her to explore in different clinics such as primary care, diabetes, cardiology clinic, and so on. Professor Lee has been involved in research related to health science research, collaborative care, comprehensive medication management, non-communicable disease, preventive care, and immunizations.
So hi, Professor Lee. Thank you for joining us and good to see you here. Could you tell us a little bit more about yourself?
Hi, everyone. Thank you, Christy. Thank you, TK, for your kind introductions. I think you have nicely summarized in a nutshell. So like TK has introduced me, my name is Joyce Lee, and I'm a health sciences clinical professor from School of Pharmacy and Pharmaceutical Sciences at University of California, Irvine. My practice interest is in chronic disease management and, of course, innovative practice as well. So I also like to create and implement and also validate algorithms that are practical and also be able to help patients to better control their outcomes.
Thank you, Professor Joyce Lee, for joining us. So as you know, today we are here to discuss diabetes, aligned with the World Diabetes Day that happened this month. So according to the International Diabetes Federation, in 2019, we know that 463 million adults are living with diabetes. So diabetes caused 4.2 million deaths in 2019 and cost at least $760 billion in health expenditure in 2019. So the proportion of people with type 2 diabetes mellitus is increasing in most countries and is projected to hit 700 million by 2045. So the most scary thing is that 1 in 2 people with diabetes in 2019 were undiagnosed. So what do you think about the disease pattern, Professor Lee?
Well, I think overall, when we look at the statistics, it is definitely concerning. And knowing the fact that diabetes is multifactorial in nature, especially type 2 diabetes, we know that the complications can be quite concerning, and it can affect patients' quality of life. Of course, very costly as well. But I always like to think of more positively by thinking that, I think the number is rising, but perhaps it's because people have increased their awareness about the disease states. So there are more healthcare professionals who are actively screening their patients, and also patients are also more forthcoming to get themselves checked up regularly, and therefore the number is increasing. So this is how I like to think of. And of course, along the way, we should also think about how to better manage our patients through a different approaches, and then learn from what have not worked and trying to come up with different ways and means to help them live healthy and long life.
All right, thanks, Prof. Lee for the insightful comment. Right. So talking about patients, actually, let's look at from diabetes and the experience of diabetes from a patient perspective. So my question to you is, how does diabetes could affect the patients who are living with diabetes? Right. How does it affect the patients and their lived experiences?
So in terms of complication.
Yep.
Yeah.
Yes.
So, so how does diabetes affect patients? Well, I think in general, interestingly enough, many patients will tell you that they feel just fine because some of the early signs of diabetes-related complications are actually insidious in nature. So patients may not feel sick enough to seek for care. So this is where patient education becomes really important. And so we should really empower our patients to recognize or, look for those signs. Some complications related to diabetes can be reversed if caught early. But of course, once the damage becomes permanent, the diabetes-related complications can be very costly, and they can decrease patients' quality of life. So these complications can also affect mental health. And so, in fact, depression is actually one of the most common comorbidities of diabetes.
I see. So as we are talking about the complications, I would like to ask, what will happen to the world if diabetes is left untreated or unaddressed?
If diabetes is untreated or unaddressed, I think many patients will suffer from the complications. So I think the goal here is to really manage patients who are uncontrolled, increase their awareness about the severity and the outcomes that they ultimately they may potentially suffer from, but also at the same time to provide them with positive messages and telling them that, if they get controlled now, they don't have to go through all the complications. So in a way to give them the positive message, and of course to increase the public awareness about pre-diabetes.
I see, Prof. Pre-diabetes and increased awareness of diabetes among the patients. So I guess the next question that I want to ask is, as pharmacists, what are the kind of role that we play in prevention, preventing diabetes and protecting the health of the population?
Yeah, so in terms of prevention, pharmacists are able to help screen the public for pre-diabetes or diabetes and using appropriate point of care systems and surveys. And they also work collaboratively with the healthcare team to delay the development of type 2 diabetes through lifestyle modifications, such as weight loss and smoking cessations, and of course, through the use of pharmacological treatment, such as metformin, in the high-risk patients with pre-diabetes. In terms of management, pharmacists are able to look at the patients holistically to ensure the safe and effective use of anti-diabetic medications, and by coming up with individualized therapeutic plans and goals with the patients, of course, and providing direct modifications of the anti-diabetic agents under collaborative practice agreement. So robust clinical trials have shown that when compared to the usual care, pharmacists involved collaborative care model is able to improve clinical, humanistic, and cost outcomes of patients with uncontrolled type 2 diabetes.
I see, Prof. So how does the collaborative care involving pharmacists look like on the ground?
So it basically involves different experts of diabetes management. So we know that diabetes as a condition is multifactorial. So people may have different challenges. Not everyone is having diet-related problems, and not everyone is having similar problems. So we want to target patients based on their needs. So on the ground, the collaborative care model can include, of course, physicians, as well as dietitians, nurses, pharmacists, clinical pharmacists, as well as psychiatrists or psychologists. and also general workers who actually look into patients' medical backgrounds, and including social workers as well.
Oh, wow. That sounds like quite a wide spectrum. Hi. Yes, Christy.
Yes. Next, for the next question, as we were talking about pharmacy, and we are all from pharmacy student, pharmacy professor, we would like to ask, like, what are the different settings that pharmacists work in this effort? Example, like policy, community, hospital, private. So in your opinion, which settings are more accessible to people with a high risk of getting diabetes for effective problem?
Okay, to address your first questions in terms of different settings and what are some of the work efforts that pharmacists provide. So pharmacists, regardless of practice settings, are equipped to care for patients at different phases of their diabetes journey. So the care provided by the pharmacist, in my opinion, is patient-specific rather than setting-specific. Now, in terms of why settings are more accessible to people, no doubt it will be community pharmacies. Community pharmacists are the first-line healthcare providers for most of the people with minor ailments or for simple medical consultations. In the United States, patients visit the community pharmacist 12 times more frequently than their primary care provider. And because of the convenience and the accessibility that pharmacists in the community settings are able to support to the public, and this includes economically and geographically underserved populations, community pharmacists are able to create and provide unique opportunities to raise diabetes awareness, as well as to provide diabetes prevention programs.
I see.
Oh,
So how does a pharmacist ensure the medication adherence to patient with diabetes? So, like in the case where the patient has like difficulty complying with the medication they're prescribed to, or so what should a pharmacist do then?
Yeah, so how does the pharmacist ensure the medication adherence
Yeah,
of the patient with diabetes, right?
yeah.
So, well, there are different approaches, but the most effective way that I believe is to take the holistic approach. So, for example, normally in the clinic, I would mention a few medications that the patient is taking, and then I would ask the patients to tell me a little about the medications and how he or she takes the medications. I would also listen to their stories, compare that against their past medical history, and then making sure that their presentation matches with the results from their glucose meter or diary, and of course their current lab values. So I would know that the patient is adherent to their medications when what the patient says about their medications reflect or mirror their current presentations, their lifestyle, and the disease control.
I see, Prof. So those are very good practices that I think we can practice when we are interacting with the patients, right? So I think one of the things that we ask ourselves is complication of diabetes, and we're just wondering, right, if there is a need for the diabetic patients to regularly do checkups, or what are the kind of thing that they should monitor so that they would prevent themselves from getting the complications of diabetes.
Sure. Um, Well, so a regular body checkup, including immunization, is important for everyone. But specifically in terms of the frequency of diabetes management, it will really depend on the control of diabetes and, of course, the presence and the control of the rest of the cardiovascular risk factors. In the pharmacist managed diabetes clinics that I run, our follow-up frequency varies anywhere from 2 weeks for someone who has just started on insulin to 3 months for someone who has achieved good improvements. So as for recommendations for preventing complications, I like to use the acronym SWEETS, and it is something that I have come up with to help my students to learn better. So the letter S stands for self-monitoring of blood glucose, because glucose readings do change behavior. W stands for weight control. The double E stands for eating right and exercise as tolerated. The T stands for timely follow-up or management. And last but not least, the last letter S stands for self-worth or self-value. So people living with diabetes should know that they matter and that they deserve better. Self-worth or self-value drives the act for the better and ultimately preventing unwanted complications.
I see. So this is a wrap-up question. So what would you like to say to the future pharmacists, so like us, who are under our federation about diabetes?
About diabetes. Well, diabetes is already a very common condition that all the pharmacists, even as a students or as a experienced pharmacist, will encounter. So it is a condition that I hope that everybody will get to know well, and also know that when we talk about diabetes management, we're not just talking about managing the sugar, we're also talking about managing the cardiovascular risk factors, because we know that diabetes is equivalent of heart disease. So when we actually look at patients with diabetes, we can just focus on the sugar readings, but we should also talk about heart health, such as smoking cessation when appropriate, and also to monitor the blood pressure, and as well as to help patients evaluate their lipid profiles. Other things to note is that when we talk about diabetes, because it's multifactorial, it can just be about medications. Even though medications are important, because currently diabetes has no cure yet, so a lot of times patients do depend on medications for a good control. But I always like to call the medications or anti-diabetics as a optimizer of lifestyle modification, meaning that patients need to live healthy, they need to exercise, need to eat well, and when they are not able to control their blood glucose still, then that's when the medication comes in and then help them and support them along the way. At the end of the day, there are only so many medications that we have for anti-diabetic agents, though there are many. So the management is definitely much easier compared to before, where there's not enough different aiming different mechanisms of actions. But I think at the end of the day, we have to look at the patient holistically and also talk about the lifestyle modifications, looking at their mental health, because it's a chronic condition. It doesn't go away just like an acute condition. It's something that they have to coexist with these conditions. So we need to look at their mental health, and it's important to listen to the patients, not jump right into the medications, because sometimes the reason for not being adherent or not being controlled a lot of times may not have anything to do with medications. So pharmacists can be creative using our knowledge as drug experts, and help patients to be creative and help them achieve their own personal targets.
I see. So that was such an important lesson for us. Listening to the patients, be creative as a future pharmacist, right? So thank you so much, Professor Lee, for joining us and sharing with us the insights and wisdom about diabetes and role of pharmacists in management and prevention of diabetes. Thank you, Professor, for your time, and we hope you take care. Thank you.
Thank you.
Yep. For the audience, thanks so much for joining and listening to us on our first ever discussion with our professional on diabetes. Hope you have learned something new and insightful today, and let's get involved and fight against diabetes. Thank you.